This is a pre-bariatric visualization for sleeve surgery. The purpose of this visualization is to help you, both mind and body, to relax and to help your body understand what's going on. Research has shown that if your body knows what's happening and what to expect, there's less trauma in the body, it recovers quicker, and it usually needs less pain medication. So let's get started. First thing I would like to do is have you look at this picture of what the vertical sleeve gastrectomy looks like. Notice which parts of your stomach will be reduced. It's going to kind of cut off this piece right here, and it's going to leave this piece right here. It's going to be about the size of a banana. And so that's the part that's going to go, and hopefully you've seen this picture before. The reason I show it to you here is because we'll be referring to this in the visualization, and so I wanted to just have you review that as part of what we're going to do. So let's get started. All right, so just find a place that is nice and relaxing for you. It can be a chair, it can be a bed, a floor, wherever you feel the most comfortable, because you're going to be here for about 20 minutes and want you to be just as relaxed and comfortable as you can be. And when you're ready to go, I want to start out with some nice, deep, relaxing breaths. Just breathe in as long and as far as is comfortable for you. Breathe out. Find your best speed, the one that leaves you the most comfortable. In with the calm, and out with any stress or tension that you might be holding in your body. And as you breathe in, you breathe out. Begin to just let your body relax. Begin to find its best place for calm. And let it sink into the chair or bed or wherever you are relaxing. Let it sink deeper and deeper there into relaxation. As you continue to breathe in and out, starting at the top of your head, just imagine that there's a stream of relaxation that starts at the crown of your head and flows through you, flows over your eyes and face, your hair, down into your neck and shoulders, and arms and back. Into your torso, your heart, lungs, spine, down into your abdomen, your pelvis, and your hips, thighs and knees, down into your calves and your feet, and finally just flows out your toes. Take a minute as you're breathing and relaxing to let that flow of relaxation, that stream, develop through your whole body. As you continue that flow, feel yourself relax deeper and deeper. Begin gathering your thoughts to a central place in your mind. As they get there, they start slowing down, becoming more and more relaxed themselves. And as they slow down and stop, it becomes easy to load them onto the basket of a hot air balloon. It's almost as if they want to float in there on their own. So gathering your thoughts, putting them in the basket, slowing them down until they stop. Noticing that your mind is becoming more clear more free from distraction, able to focus on the sound of my voice. Relax and release as your thoughts get loaded into the basket. Just push the balloon away and let it rise up in the air, moving farther and farther away from you, farther and farther up in the sky. The more the balloon rises, the calmer your mind is. The farther away the thoughts go, the more deeply you relax. As you sink deeper and deeper into relaxation, let your awake mind go to the place it goes when you sleep. Let it just move deeper and deeper to sleep. Less and less aware of anything but just relaxing and resting. Let the unconscious part of you become more and more aware of the sound of my voice. And so we'd like to work with that unconscious part in your body in order to prepare it for your VSG surgery. First, we want to start with the picture that you saw a minute ago that shows you the part of your stomach that will be changing. We want to take the life force, the essences that live in that part of your stomach, and move it to the part that's going to stay. Your stomach instinctively knows how to do this. Once you put the process in motion, you won't even have to think about it. It will be done by the time you're ready for surgery. So let that process start now, moving its life force into your stomach, into the part that's going to remain. And also we want to thank your stomach for the incredible amount of work it's done all your life. It's taken whatever you've brought down to it, whatever you sent down to it, it's taken that. It's processed it. It's been faithful and loyal. We want to recognize that and we want to thank it. We also want to thank the part of your stomach that's going to stay and heal and continue to work for your best health, because that's important as well. So now we want to think about the surgery itself and prepare your body for it so that it doesn't get traumatized, it doesn't wonder what's going on, because it's ready for it. So we want to start with the day you get up. Get up in the morning, you've got your alarm set, you wake up and you're nervous-sided, but you know that today is the day that it begins a whole new episode of your life. Some people call this their second birthday. Get up and you shower, and you're going to use the shower stuff that your surgeon may have given you and follow it according to instructions. Some surgeons like you to do it a couple of days before to prepare the area. Some of them just want you to do it the morning of. Some of them don't give that instruction at all. So take your shower and get the body ready for its adventure. And as you dress, you feel your feelings. You notice what you're feeling. Anything that isn't excitement or optimism, just breathe those feelings out. Just breathe them out and breathe in calm and peace and confidence. Then you get to the hospital, and at the hospital you'll check in and let them know that you've arrived, and you may be in a waiting area for a little while, but that's okay. You'll feel calm, you'll feel comfortable there. And you may want to do some nice deep breathing and just relax. After your name is called to come back to the prep room, you will be given a hospital gown and footies and instructions about how to get ready. And you'll do this with excitement because you've been waiting for this to happen. It's been really, really fun that the day is finally here. Maybe a little excited, maybe a little nervous-sighted, but it's finally here, and you're feeling that anticipation. So you get ready, and you're going to be visited by nurses who are going to take your temperature and blood pressure, probably by your anesthesiologist and your surgeon. And if you have any questions for them, you'll remember them, you'll ask them, and you will get all the clarification that you need. And you'll work with them for your best help. Presently, you'll get an IV. This may happen in the prep room, it may happen in the operating room. When it happens, your arm or your hand, wherever the IV goes, will accept it with excitement as its way to contribute to this process and to you being healthy. And then they'll take you to the operating room, and you may notice the temperature is a little cooler there. That's for your safety while they're working there. And you'll lay down on the operating table and you'll just sink into it. You'll just consciously let your body relax into it. It's not the softest of places, but you'll feel yourself just relax into that table. Your anesthesiologist will be there, put medication in the IV. And presently, you'll notice the hustle and bustle, and you'll see your doctor and the nurses working to prep you. And presently, the anesthesiologist will put an oxygen mask over your face and ask you to breathe in deeply. And after 3 or 4 or 5 breaths, you'll go straight to sleep. Your conscious mind will go completely to sleep. And then it won't remember anything. Your unconscious mind and your body, however, will be aware of what's happening, and they'll feel calm and relaxed because they know that they're in capable and good hands. The nurses will prep your abdomen, they'll disinfect it, and they'll get it ready for the procedure. Then your surgeon will make some small cuts along your abdomen, and the surgeon will put in an air tube and a camera and add air to your abdomen to inflate it so that they can better see all the organs that they're going to be working with. The surgeon will also put in a device that looks sort of like a claw hand that will be doing most of the work. And the surgeon will use the camera to guide their work. So once the hand is in there, your stomach will be reshaped. It won't take very long because the machine both cuts the stomach and staples it back together in one process. So the surgeon guides the hand to where it needs to go to make that happen, and your stomach has already put its life essences into the part that's staying. So all that's being cut off right now is pretty lifeless tissue. And as your stomach comes together and is stapled, the parts of your stomach that are coming together come together like pieces of a jigsaw puzzle, as if they'd been born that way. And they start to heal immediately without too much problem or inflammation. Your body knows exactly how to make that happen. That's the body's default, is to heal. And so the surgery is finished pretty quickly. And your stomach is starting to heal right away, pretty quickly. When that part is done, the surgeon pulls out the claw and the camera and gets as much air out of your abdomen as they can. If there's any left, it will process out in a very natural way in 2 or 3 days. There may be a little pain there, but it won't be too bothersome. If there is pain, if you're noticing pain, it's usually shoulder pain. Talk to your doctor or the nurse and let them know. They'll let you know what to do for that. Once the instruments of surgery are gone, the surgeon will then repair your abdomen either through stitching or just steri strips. And as soon as those parts of your abdomen come together, it will be just like jigsaw puzzle pieces again. It'll be very easy. They'll grow together quickly, heal quickly, without infection, with very little inflammation, just enough inflammation to promote the healing process. And once that has happened, the anesthesiologist will stop the anesthesia. And once that anesthesia stops, then after a little while, you'll start to come back into wakeful awareness and consciousness. And they'll wheel you into the recovery room and monitor your vital signs to make sure you're okay, and you will be. And after you've been there a little while, 15 to 45 minutes usually, you'll become more aware of activity and voices, and your eyes might flutter open. And when they see that you're starting to wake up, they'll call your name and try to get your attention and do the best you can to wake up and to communicate with them. As you wake up, become aware of the need to breathe in and out and to work the anesthesia through your system so that you can become awake quicker. And when they decide you're ready, you'll be reunited with your support system and go to your room for the night. And in that room, lots of good things happen. Depending on the hospital or surgical center and your surgeon, they may give you a solution to sip, and then they may do something like an X-ray to see if there are any leakages in your stitches or your staples. But things will be fine there, and then you'll be back in your room. They'll give you tiny little cups of liquid to drink. Usually it's water, and be sure to drink them, but drink them slowly. Sipping is super important. Your stomach has undergone a new process, and so it's going to need you to sip for a while as it recovers from that process. You'll notice that you'll feel a little bit different, which is to be expected, of course, but it won't be necessarily a bad feeling. You'll also want to get up and walk around as quickly as you can and as much as you can, or as much as they let you. Make sure that you don't walk by yourself until you're absolutely sure that you're not going to get dizzy or fall over. It's very important to have other people there, but it is important to start walking when you can, as soon as you're cleared to do so. You'll spend the night there, and there will be some pain, but it will be manageable if you stay in front of it. You don't want your pain level to get over a 4. So if you notice that is 3.5 on a 1 to 10 scale, you want to ask for some pain meds. And because of the type of surgery, and because of the visualization, and because your body knows what's happened to it, and it's not going to be traumatized, because it knows there's supposed to be a little bit of pain and it knows the reasons for it, you'll find that your need for pain medication isn't as great as it would have been otherwise. So don't worry about it. Your need for pain meds will decrease pretty quickly, so that 3-4 days out, you probably won't need any, or you won't need very much. And so ask for what you need and stay in front of that pain. But expect that there will be some, and that's okay. It's part of the process. If things go well, you're usually discharged to go home the next day. When you get home, you want to do a couple of things. One is to keep breathing those deep breaths, because that helps strengthen your lungs and keep the anesthesia, keep moving it out. And they might even give you a little challenge breather machine in the hospital to help you with that. You also want to walk, and you want to rest. You want to make sure that you stick to your eating schedule, whatever schedule the surgeon has given you. You want to stick to that religiously, because your stomach is still healing. If you want to know what's going on inside your stomach, look on what's going on in your abdomen. You'll see the healing process happening there. Same thing's happening inside, only in your stomach, it's also being asked to do some work to process liquids in the beginning, and then in 2 weeks to process pureed foods. So be gentle with it, be kind to it, and don't be afraid of it. There will be a little pain, but you can minimize the pain by eating really slow, think slow motion, and also by doing what the surgeon has asked you to do. And so what I'd like you to do, now that in the visualization we've got you home, I'd like you right now in this relaxed place that you're in to do a body scan. Start at the top of your head and move through your whole body down to the bottoms of your feet. And notice if there's any part of your body that's feeling nervous or negative feelings about this process. If there is, notice where you're feeling that. And notice what the feeling is. Just take a note of it. Remember it, because I'll want you to write it down in just a minute. Once you've done that, I want you to do one more scan. This time, I want you to notice if there's any part of your body or mind that have any questions. Again, if there is, please note that, because I'm going to want you to write those down in a minute as well. All right, so when you're done, I'd like you to wiggle your toes and your fingers, and when you're ready, let your energy levels come up and open your eyes and come back to the room. And now we want to do what I like to call a reflection workout. When you do a visualization, or actually any kind of workout that is for your body, mind, spirit, it's helpful to gather any insights that you gained during the workout. So during this visualization, I want you to think of any insights that you gained and write those down. They could be insights about anything. It doesn't even have to be about the surgery, but any insights, and write them down. And then if you had any of those feelings that we talked about, fears or negative feelings, write those down as well. And then think about how you can best resolve those feelings. You need to talk to your medical provider or your counselor or a friend. Is there a way to resolve those before you have your surgery? If you don't have any way to resolve them or anyone to resolve them with, you're welcome to call my office, and the phone number is there on this workout page. And we can have a consultation if I've got time. I'm happy to work those with you. And then the second part was the questions that I asked you to see if your body had or your mind had. And if you've got questions, write those down as well, so that you can discuss those with your surgeon or your medical provider or another appropriate person to have that discussion with. And this workout becomes really important. Becomes kind of a guide to the time between now and when you have your surgery. This is the part you want to clear up before your surgery. I wish you the best. You've got this. It's going to go well. Just let it happen and have a lot of faith in the process, in yourself, and in your providers. Take care. Best of luck.